People make decisions every day that involve small risks to their health or to their life. These include things like driving a car, smoking cigarettes, working in dangerous occupations, or buying safer but more expensive products. Now, these decisions all involve a trade-off between money and risk, even when the risk is small enough that we don't really think about it when we're involved in the transaction or in the action. For example, some jobs are riskier than others, but end up paying you higher wages. Economists use these trade-offs to estimate the value of a statistical life. The value of a statistical life measures how much people are willing to pay to reduce small risks of death. It's important to state that the value of a statistical life does not represent the value of a specific person's life. Instead, it just reflects how much people value reductions in mortality risk. So we can use this idea to generate population-wide estimates of the value of life, which is really useful for determining the costs and benefits of safety regulations and for economists for estimating hedonic wage functions. Now, the idea that wages compensate workers for unpleasant job characteristics or dangerous job characteristics goes all the way back to Adam Smith. So back in 1776, Smith observed that wages vary with job difficulty, with working conditions, social status, and risk of injury or even death. So riskier jobs tend to pay higher wages to compensate workers for the danger that they face. These wage differences are called compensating differentials. So you have to compensate someone for the negative aspects of the job, in this case, bodily harm. It's the same basic idea that causes third shift workers to get paid more than the first shift workers, even at the same job, because there's something unpleasant that you need to pay people extra to get them to be willing to do. Now let's illustrate how economists estimate the value of a statistical life. Let's think of an example with just two jobs. So there's an office job. The wage is $55,000 a year, and the average fatality risk is 1 in 100,000. We also have a construction job. The wage is $65,000 a year, and the annual fatality risk is 2 in 100,000. The construction job pays $10,000 more per year, but it also has an additional fatality risk of 1 in 100,000. So implicitly, workers are accepting an extra 1 in 100,000 chance of dying in exchange for $10,000 in additional wages. Like that's an actual trade that they're making. So if we scale this up, it's as if workers require $10,000 to accept a 1 in 100,000 increase in mortality risk. Then they would require basically $10,000 times 100,000, so $1 billion to accept certain death. I know this seems a little crazy to think about. That's taking it to an extreme just so we can calculate this. So in this example, it would imply a value of a statistical life of $1 billion. Now, this number is unrealistic because our example used exaggerated numbers. It's also unrealistic to think about someone accepting that much money for certain death. But when economists estimate these trade-offs using real data, they typically estimate that the value of a statistical life is around $4 to $9 million in early 2000s dollars. So to estimate these trade-offs, economists use the hedonic wage regressions. The basic idea is that we estimate how wages vary with job risk after controlling for other factors. So that way we can identify jobs that are exactly the same, except for the amount of risk on the job. So the regression equation typically looks something like wage being a function of job risk, education, experience, a particular occupation, the industry, and so on. So workers with more education or more experience tend to earn more. So economists want to control for those characteristics. After you account for worker characteristics and job attributes, the remaining relationship between wages and job risk reveals the price of risk in the labor market. Economists can use that price to convert it into the value of a statistical life. Viscusi and Allaby reviewed dozens of studies using real labor market data, and they find that most credible estimates of the value of a statistical life in the United States fall between about $4 million to $9 million. Importantly, they use several different methods to estimate the VSL, the previous works, and they all yield generally similar results that fall between the 4 and 9 million. The central insight of this strain of literature is that by observing how workers trade wages for job risk, economists can estimate how much people value reductions in mortality risk. And these estimates allow policymakers to compare the costs of safety regulations with the benefits of lives saved.